Okay, so let's move on to the next section. This is for elderly people. So how about elderly people? How about senior citizens? So there's a kidney problem, liver problem, non-healing foot ulcers, forgetfulness, dementia, joint pain, muscle pain, bone pain, all kinds of problems keep. Is there a possibility for our elders to regain their health so that they don't have to become so dependent on their next generation? We welcome Dr. Ellis Jayachandran Vivian, MBBS D Ortho from CMC Vellore, FRA CGP. He has a scope certification from the World Obesity Federation. He's a member of ANZOS, the Australian New Zealand Obesity Society. He was an observer of Dr. Jason Fung in his clinic in the reversal of diabetes and management of obesity. Welcome, Dr. Vivian. We are happy to have you for this interview.
It's a pleasure, Tina. Thank you. Thank you for having me.
Okay, so let me go straight to the questions. So how about elderly people? How about senior citizens? I've observed two kinds of mindsets when it comes to elderly people. Those who don't want to change and those who don't know that they can change. So the first type of people I see, they say, no, I don't want to try anything new at this stage. I will continue things as they are. Maybe, things will become better. Or they think, okay, maybe it won't become better, but it will be as it is. I'll maintain status quo. But I want to say here that the reality is things will not remain as they are. If you just zoom out and observe, the past 3 years or the 5 years, past 10 years of your life, you will realize that one problem leads to another, leads to another, leads to another. Because by definition, these diseases are chronically progressing. The disease is progressing. The human body is degenerating. These are degenerative. So there are, one after another health complications day by day because the root cause of insulin resistance and leptin resistance haven't been addressed. So there's a kidney problem, liver problem, non-healing foot ulcers, forgetfulness, dementia, joint pain, muscle pain, bone pain, all kinds of problems keep coming. So I'd like to offer this perspective to people who think that it's going to remain the same, that it may not remain the same. It may get worse in high probability. The second kind of people I feel is people who say, I would like to become better, but I don't know if it is even possible. Is there a possibility for our elders to regain their health so that they don't have to become so dependent on their next generation? What if I get a hypoglycemic episode? They need constant care because one after the other, these diseases have piled up on them. They need somebody to constantly supervise them or be with them, or sometimes they even need to be admitted in a nursing home because home care is not even possible. These chronic progressive diseases have pushed our elders to that level. So there are some people who think, I would like a change. I would like to do something if it is possible to change it. So to these people, can you explain to them whether it is possible, or if it's too old, oh no, nothing can be done, or oh yes, something can be done, change is possible?
Okay, Tina. There are two factors at play here. One is the knowledge and the other is the willingness. To bridge the gap in knowledge, we can tell the elderly things can be reversed. You can have a good, healthy old age. Old age does not mean diseases. Old age can be actually enjoyed. This will address the knowledge gap aspect. So I want to encourage every elderly person that if they decided, it is possible to reverse these conditions and reduce the pain and suffering associated with these conditions. The next question is the willingness aspect, and that needs to come from the other side. Some people are really motivated, and some people, for various reasons, they don't have enough motivation. So to get a healthier outcome, both of these need to be matched. The knowledge gap has to be addressed, and the motivation and willingness also has to be addressed. One without the other will not give you a good outcome. I'm happy to encourage all our elderly people that anyway, there's going to be some discomfort. If you're going to continue in your disease state, it's only going to get worse, more painful, and it's going to be a lot of suffering. So are you willing to undergo that type of suffering, which will have definitely a bad outcome? Or are you willing to do something, take you out of your comfort zone, cause some discomfort, and then give you a better outcome? So at this stage, the knowledge gap is fixed. The motivation can be worked on. It's for them to decide, am I going to suffer and have a bad outcome, or I'm going to go into some discomfort and have a good outcome? That's up to the mindset of the individual person.
That's encouraging to know that there's hope. And if somebody wants to change, then there is a possibility for them to reverse their conditions and live a much healthier and a longer life.
Yes. I have seen many people take up this offer, and we have de-prescribed medications and seen good outcomes. De-prescribed in the terms, de-prescribed in a good manner, not just cut it off because they are in end stage, their life. Yeah, I have seen people coming off the diabetic and the hypertension tablets in their old age.
And this is possible even for, say, for example, a person is taking insulin shots and is on highly diabetic for many years, has had heart surgery and stuff like that. So they think it's very complicated. Is it possible? It is possible.
But it takes some time. It is slowly possible, and it depends on the individual, conditions as well. We can't give a blanket statement that everything is possible for everybody. But with the consultation of a LCHF doctor, it is definitely possible. I do not personally subscribe to the mindset that aging is disease-ridden and disease-prone and a decrease in health outcome. You can age well without chronic diseases.
It is possible to be a golden oldie and enjoy it.
Yeah, definitely. Oh, life is full of them. Yeah.
I'm so glad that you addressed this issue, because this offers hope to a lot of elderly people who might have previously been of the mindset and the belief that, nothing can be changed, I'm too old. So at this point, I'd like to quote the example of our mother, Paul and Satyakumari. Her videos are available in the list, The Elderly. She's Dr. Vivian's and my mother. Dr. Vivian is my brother. She decided to make this change after 25 years of progressive diabetic medication and 2 years of statin medications. At one point, she was advised to take insulin shots. At that time, she took this decision saying, by then, my husband and I were 2 years into the LCHF lifestyle. So she said, okay, I want to do this. I'm not going to get insulin shots. I'm not going to make my health any worse. I want to get better. I want to try this. At that time, she was living with you at your home. She was living with my brother, Dr. Vivian, and therefore with his supervision and the consultation of Dr. Vijay Raghavan, she was able to change over to an LCHF food and lifestyle and completely wean off her medications. So I encourage you to watch her videos. She's an example of how one need not be a slave to food and to medicine and, a need for constant company and supervision. There was a time when I used to be afraid of leaving her at home for an overnight trip or something, thinking, what if she forgets her medication, or what if she gets an episode of hypoglycemia and slips and, becomes faint or something like that. So now she's free from all that. She doesn't need to be constantly supervised or need constant company. She's not a slave to constant medication, to looking at the clock and having to have food and medication. She's free from chronic sickness and chronic medication and is living a happy and healthy life. So it is possible to have a healthy old age, not necessarily a sick old age. So thank you for giving our viewers that perspective and that hope. Dr. Vivian, thank you so much for answering my questions and spending time with us. It will be very useful for our viewers to better their health. Any parting thoughts that you may have?
You're most welcome. It was my pleasure to be on this show. Your health is in your hands, and what you put in your hands to take to your mouth. As doctors, we can advise, coach you, and guide you, but ultimately, it is in your hands. All the best for your good health.
Thank you for answering all our questions. I'm so glad that there is yet hope. There is hope. We don't have to necessarily get some chronic progressive disease and die of that disease, but it is possible to have a healthy life. When we are advised to reduce weight, it is possible. Before, what said, reduce your weight. And we were advised that in order to reduce weight, we have to eat less, exercise more, calories in, calories out, use your self-control. And in that philosophy, things were not working out. But now when health experts tell us to reduce our weight, it is totally possible and sustainable on the LCHF lifestyle, which is LCHF food and intermittent fasting. So it is very encouraging that we can have longer and satisfactory, healthy lives. There is hope that we can add many years to our life, and we can also add life to our years. Thank you so much for watching. Do write into us if you have any questions or doubt. If you want to know what LCHF foods mean, what are the food items that we can have on an LCHF diet, and to know more about fasting, do visit our website and our YouTube channel. Don't forget to hit the like button if you liked our video, and don't forget to subscribe and turn on notifications. Please do share this video as much as possible. This information and this message of hope that we can live healthy lives and live long is necessary in these hopeless and discouraging times. So please share this video as much as you can. Thank you once again, Dr. Vivian, for being with us and shedding light on so many issues that have seemed so vague and hopeless. Thank you.
Thank you. And again, it's my pleasure.
Wishing you all good health and long life. Thank you.